If you have any questions or comments during the webinar, just type them into the chat box and we'll answer any questions at the end of the webinar, which we should be wrapping up about 12:45. So with all that said, I'd like to introduce our speaker for today, Kristen Martin. So Kristen is a geriatric care manager with Elderlink, Options for Caregiving, and she's been in this field for many years. She's also done this webinar for us before, and she has a wealth of knowledge, but I think the most important thing that you need to know about Kristen is beyond her wealth of knowledge, she cares very deeply about caregivers. And any time that you ask her a question or you are fortunate to have an interaction with Kristen, you will come away with knowing that you've been heard and that you've gotten information that will be of benefit to you and as timely and accurate as a person can get out that information to you. So with all that said, I'd like to turn it over to my colleague, Kristen Martin.
Great. Thank you so much, Lucy. Good afternoon, everyone. As Lucy mentioned, my name is Kristen Martin, and I am a geriatric care manager with Elderlink. I work primarily with the respite program with the goal of providing a temporary break to a caregiver who is caring for their loved one at home. And over the past 8.5 years, I've certainly come to appreciate and understand the stress and hesitation surrounding the decision to hire in-home care. It may be the uncertainty of not knowing what kind or how much help is needed, wondering where to find the best care options, likely concern about cost, and probably the biggest obstacle of having that comfort level of hiring a provider to come into your personal space and the personal space of your loved one. The majority of us want to age at home until our final days. And if you're listening this afternoon, whether you are looking at care options for yourself, for a parent, or for your partner, I can assume that you also place importance on this value. In-home care services, whether it be minimal assistance to full-on care, provides the opportunity to achieve this goal of remaining at home, as long as that remains the safest plan of care. I'd like to start off by describing Elderlink in a little more detail. So Elderlink is a public-private partnership with Inova Health System and the Fairfax Area Agency on Aging. And overall, we are a case management organization, although we also oversee several of the Fairfax County funded programs. Through our case management or care coordination component, we assess, we plan, we implement, we coordinate, we monitor, and evaluate options and services needed to meet an individual's needs. So to sum that up a little more succinctly, we take a look at what is working well, what is not working so well, and then we develop a plan of care to help meet the needs that have been identified. The mission of Elderlink is to maximize independence and safety of older adults who are living at home by helping to coordinate care, while also supporting family caregivers in their caregiving role by helping them look after their own health and well-being. According to AARP, 9 out of 10 older adults would prefer to age at home. However, individuals who may have hard-to-manage chronic conditions or increased frailty need more frequent care and supervision. So a good first step is to start by assessing both your needs as a caregiver and the needs and preferences of the person who will be receiving the care. In general, you'll want to consider assistance in the following areas. Personal care, shown as red, known as ADLs, or activities of daily living, so the bathing, dressing, toileting, eating. Household care, known as IADLs, or instrumental activities of daily living. So that's the cooking, cleaning, money management, transportation, shopping. And then other considerations, healthcare, such as the medication management, scheduling of doctor appointments, and equally important, an individual's emotional well-being. So this would include opportunities for socialization, engagement in meaningful activities. Studies are continuing to show the positive effects of social relationships. And more important than genes are lifestyle and attitude in helping to determine vitality as one ages. So as a person gets older, social and physical habits, those solid social ties, become increasingly important to both mental and physical health, while the influence of genetics somewhat becomes less important. You may already know what type of specific help is needed and how often. However, in more complicated situations, or if you are just unsure of what type or how much help is needed, it may be helpful to bring in a geriatric care manager to provide an objective look into what the needs in the home may be. Having that objective look is beneficial because it is sometimes difficult for the person needing help or the loved one involved to determine what type of assistance is needed or how much assistance is needed. Individuals or family members sometimes underestimate or may even overestimate the extent of abilities related to a certain task. So the first step is determining what kind of care is needed. Does your loved one need help with personal care, so the bathing, dressing, or other types of hands-on care? Is help needed with the instrumental activities of daily living, the laundry, cleaning the house, preparing meals? Does he or she have any cognitive problems that pose a safety risk? Ask them what they would do in the case of an emergency. Are home modifications needed? Maybe a bathroom grab bar, a bed rail, or a shower chair. Ideally, you would want your loved one to tell you that help is needed, but that is usually not the way it goes. Unfortunately, it is often a sudden illness or some sort of crises that signals that help is needed. But when the need for help is not as obvious as being directly asked or the result of a crisis, a good first step is to assess the situation. You want to identify the areas that your loved one is perfectly fine handling on their own, and that's a relative term, and what are the areas where they might benefit from more assistance. Adults of all ages benefit from feelings of independence and autonomy, and concerns about a loss of authority and independence can be barriers to asking for help or seeking assistance from family members or friends. Regardless, when it comes to talking to your loved one about needs, start the conversation early so your loved one has time to adjust to the concerns and then adjust to the suggested solutions. And your conversation doesn't have to focus only on a caregiving plan. You may also consider just talking generally with your loved one about what is most important to them. Many folks appear motivated to talk to their loved ones by a desire to plan for the future, but sometimes it's hard to know where to begin. It can sometimes be challenging for a family member to navigate this role, and in those cases, a geriatric care manager is an objective third-party professional who can provide an assessment of the situation. A care manager will help determine what your loved one is able to do fine on their own and the other areas where more assistance may be needed, and then help to connect to available resources, coordinate with family members and doctors, and respond to changes in the caregiving situation as they develop. Care managers can be found through the Department of Social Services, the local area agency on aging, or you can search through the National Association of Professional Geriatric Care Managers. So the assessment should address help needed with activities of daily living, instrumental activities of daily living, and the social and emotional needs. From that assessment comes the development of the care plan, which should include options for the type and amount of help that is needed, And this should lend itself nicely to the development of a job description for the in-home care worker. The more specific the description, the better. It should clearly state your expectations and the worker's duties and responsibilities. Regardless of the level of care being provided, the goal is to create a caregiving plan based on the needs and wishes of the one who will be receiving the care to the extent that they are able to participate. Allowing the care recipient to take a proactive approach to planning can help to alleviate family stress. The idea of outside help coming into the home may understandably cause your loved one to feel anxious. Involving your loved one in the care planning discussions and decisions may help to alleviate some of those fears. The takeaway message is to manage expectations for yourself and your loved one, as well as setting realistic expectations for the person who will be providing the in-home care. So once a plan is in place regarding the type of care that is needed and how often, the next step is to consider options for providing the care. Home health care agencies generally have a 4-hour minimum requirement per visit, with cost averaging around the $23 to $25 window. With an individual provider, you will have more flexibility with the scheduled hours, and you will also negotiate the rate of pay. However, please keep in mind that although you may not be paying the cost of agency overhead by using an individual provider, you are still hiring a professional to help provide care for your loved one, and the negotiated rates need to reflect that. Family caregivers can appear to be a low-cost option, but they make significant financial and personal sacrifices to take on the role. Initially, family caregivers spend on average somewhere between 20 to 24 hours per week on caregiving. But over time, new issues may start to arise, and your loved one is needing more than a few hours of care. You may already be juggling care for your children or grandchildren, your job, and several other demands on your time. And as the care level increases, it may eventually reach the point where you feel that you are in uncharted waters and you really don't know what to do. The son of a client I worked with commented that when mom got sick, I had to learn a lot of things really quick. So in-home care services, whether through a home health care agency, an individual provider, or a family caregiver, provides one-on-one care to your loved one in their own home. There are two primary advantages to hiring in-home care. The first advantage is aging in place, the comfort of allowing your loved one to age comfortably and safely within the comfort of home. And the second advantage is personalization. In-home care services should be specifically tailored to the needs and schedule of the care recipient. An important consideration, if you decide to hire an individual provider and the aide wants to schedule some vacation time or is not able to come one day or wins the lottery and suddenly quits, what is your backup plan? If you live in the area, you might be able to rearrange your schedule, but what's the plan if you live out of town or you can't take time off work? You may want to consider interviewing a second part-time or on-call person who can be available when your regular provider is unable to come. Calling an agency for temporary respite is another possibility. Likewise, if you are already working with an agency, regular aide is sick and cannot come, what is the agency's protocol? Will they be able to send a substitute that same day? Make sure you have a clear understanding of the agency's procedures. So let's discuss the three options for in-home care services in a little more detail. Home health care agencies. The three primary advantages to a home health care agency are level of expertise, peace of mind, and availability of potential options. So level of expertise, agency caregivers are experienced in care and receive regular training. Peace of mind, An agency should be able to ensure that your loved one has consistent care. The agency provides insured and bonded caregivers and handles all legal and employment matters. The home health care agency selected should also be able to send a substitute on short notice if the regular aide cannot be there or if additional hours are needed. And care managers are also on call to assist with emergencies. Availability of potential options. So there are a plethora of home health care agencies to choose from. So the benefit is that if a particular agency is not a good fit, there are more options to consider. Two challenges to consider are cost and schedule. Medicare and traditional insurance does not cover home care, so these costs are coming out of pocket. Long-term care insurance may cover home care services, and I'll touch back on that in a few moments. Another obstacle for some folks is schedule. Although help is needed, a 4-hour minimum requirement may be too long of a time frame, or the agency may not have an aide available during the specific hours or days that would work best for the care recipient. Aides are also restricted with some of the duties they are able to perform, such as dosing medication or trimming nails. When going through the process of hiring an in-home care agency, the Administration on Aging suggests asking the following questions, which should help to provide you with peace of mind regarding the level of involvement and responsiveness of a particular agency. So how are the agency caregivers hired and trained? How long has the agency been serving the community? What type of employee screening is done? Does the agency write a plan of care for the person with input from the client and family and update the plan as needed? How closely do supervisors oversee care to ensure quality care? Are agency staff members available around the clock 7 days a week? And who does the agency call if the aide cannot come? With an individual provider, a common advantage is financial. Rates are usually more affordable since you are not paying agency overhead. Another clear advantage is that you have more control over the scheduling of hours and duties that an aide from a home health care agency may be prohibited from performing. However, there are also several possible challenges to consider. The first is limited oversight. If the private hire is unable to come for any reason, your loved one may be left alone if you are not able to step in last minute. This in turn affects the family who will need to coordinate care if that individual provider is unavailable. The second possible challenge is level of professionalism. Private caregivers may not have the same level of training as caregivers from agencies, and there is the potential risk of abuse of privileges as there is no agency oversight. The third consideration is liability. Private caregivers may not be bonded. And another potential challenge is burden of responsibility. So the family or the individual receiving care is responsible as the employer for the private hire and will have to adhere to local employment laws. It's very important to have a signed contract. When going through the process of hiring an individual provider, you really need to make sure you are doing due diligence in your vetting process to include an interview, reference checks, criminal history check, and driving background checks. Before the individual provider actually comes to the home, it would be best to ask some basic questions over the phone just to make sure the person seems like a solid fit, and perhaps asking for references as well prior to arranging for an in-home interview. Some of the questions may include, why are you interested in this type of work? How long have you been a provider? Do you have any formal training? Do you have experience with diabetes or dementia or whatever the chronic illness may be? And how do you feel about pets or smoking or whatever else you'd like to know? In regards to the job contract, this formalizes the agreement between the employer and the employee. The contract should include the following: name of the employer and the individual provider, wages, including the tax withholdings and benefits, so vacation days, holidays, mileage reimbursement, when and how payment will be made, the scheduled work hours, duties to be performed, so this would be the job description, unacceptable behavior, so maybe smoking, inappropriate language, talking or texting on the phone, termination, so how much notice needs to be given, maybe reasons for termination without notice, and then dated signatures of both the employee and the employer. If you pursue the individual provider option, two resources or contacts that may be helpful for you for additional guidance are the Wage and Hour Division of the U.S. Department of Labor, as well as IRS Publication 926, Household Employers Tax Guide. Almost 1/3 of the U.S. population, so over 65 million family caregivers, provide care to a loved one during any given year. For the most part, there are two primary advantages of using a family caregiver. The first is comfort. Family members know their loved ones best and can provide comfort and emotional support. The second advantage is cost, as family caregivers do not require out-of-pocket expense. On the flip side, though, you must consider the time and energy invested. There are several considerations to think about with a family caregiver. And that first consideration is stress. Family caregivers experience extremely high burnout rates and stress-related physical and emotional impact. And the second consideration is time. Family caregivers must dedicate significant time to support their loved ones. Time becomes a very precious commodity, and without an opportunity for respite, caregivers run the real risk of burning themselves out. Another important consideration is level of experience. Family caregivers may lack the training and experience to provide for all of their loved ones' needs, especially with difficult tasks such as transferring or mobility support. People tend to feel overwhelmed when starting to think about possible home care options, which is very understandable. Either there are too many options and you don't know where to start your efforts, or you feel that you have no inkling where to even find available options. Well, there are several potential avenues to explore. Contact the local area agency on aging to inquire about home care services in the community. Fairfax County publishes the Home Care Registry, which provides a listing of individuals who provide homemaker and personal care type duties and who have received background checks through Fairfax County. This publication is available online through Senior Navigator, or you can call the Area Agency on Aging to request a copy. For Fairfax County residents, a helpful resource number for you to have on hand is the main intake number for our Aging, Disability, and Caregiver resource, 703-324-7948. There are also local publications, such as the Guide to Retirement Living Sourcebook, which provides an extensive listing of home health care agencies. The Sourcebook, which is published seasonally, also has an online option, but free copies are often available like in the entryways of pharmacies, or you can call the Area Agency on Aging to request a hard copy. A word-of-mouth referral is the most ideal way to find a provider. Friends, neighbors, coworkers, members of the support group that you belong to can be a goldmine of information. And for people looking into care options outside the area, eldercare.gov is a search tool to help provide you with options. But I would still suggest contacting the local Area Agency on Aging relative to where your loved one lives. So how well do different home care options compare to one another? Well, that's pretty difficult to assess. The experience of one family versus another bringing care into the home is a very individualized experience. Be realistic and anticipate that it may take a few trials before the agency matches an aide who is a comfortable fit. How responsive that agency is in addressing the issue and your concerns will lay the tone for your experience with that particular agency. With an individual provider, you will have more of an opportunity to get to know the caregiver through the interview process, so it might provide you with a better indication of how well things may go. However, please keep in mind that with all the checklists, interviews, and stellar resumes, that cannot guarantee safe quality care. So personal references from other clients and your own instincts are ultimately the best indicators of the right person or agency for you or your loved one. You need to be an involved family member to ensure that expectations are being met. I also want to mention that the Medicare website provides a rating of home health care agencies, but that is more applicable to skilled care therapy services, so physical occupational nursing, rather than home care services, so the personal care, homemaker type of assistance. Paying for home care is one of the most challenging issues for caregivers because most people must pay for service out of pocket. A lot of people are under the impression that Medicare will pay for in-home care services, but Medicare does not cover homemaker services. In addition, Medicare doesn't pay for home health aides to provide personal care unless you are homebound and also getting skilled care, such as nursing or physical or occupational therapy, usually after a recent hospitalization or discharge from rehab and following a doctor's order. If your loved one has a long-term care insurance policy, check to make sure that your policy covers in-home care services as well, not just facility care. Be familiar with the benefits, so what services are covered and how much coverage you have, and the triggers. So these are the conditions that must be met in order to receive care. Generally, the trigger is when an individual needs help with 2 or more activities of daily living, and there is usually an exclusionary period, possibly up to 120 days after the start of care, before benefits will be activated. The agency providing the care may need to be Medicare certified, or the care may need to have oversight provided by a nurse or a medical professional. So again, just be sure to check with your individual insurance policy. Long-term care Medicaid is a state and federal program and is an option for individuals who need a higher level of care to the extent that the individual is considered nursing home level of care. Applying for long-term care Medicaid is a 2-step process. The first is a functional assessment, which looks at the person's ability to complete their activities of daily living, as well as mental status, which would assess orientation, judgment, behavioral concerns, and then finally medically related nursing needs. The second step is the financial application. Monthly income and assets are taken into account, and the person applying for care must meet federal and state guidelines for income and assets. Special consideration is given to married couples in that some of the income and assets are protected for the community spouse. The Virginia Poverty Law Center provides a very thorough explanation of the process, and this publication is available online at valegalaid.org. For folks applying in Fairfax County, the Long-Term Care Medicaid office has an intake line where you can ask the eligibility workers more specific questions regarding the financial eligibility requirements. And that contact number is 703-324-7622. If your loved one is a veteran or the spouse of a veteran, the Veterans Administration may be a potential option for financial assistance. The VA has a special pension called Aid in Attendance for veterans and surviving spouses with non-military service-related medical conditions that provides financial assistance to individuals who are receiving pension benefits from the VA and who require the aid and attendance of another person to complete their activities of daily living. From experience, this is not an easy application process. The process can take between 6 to 12 months, and an applicant must meet a medical expenses to income ratio in which the medical expenses must outweigh income. The regional VA office would be the best resource of support if you are investigating this option further. So it has happened that when the idea of in-home care assistance is discussed with a loved one, the well-meaning family may be met with resistance and sometimes a little bit of resentment. Many older adults truly feel they do not need help. Some may resent what they feel is an intrusion into their private business, and others may have lost the capacity to make good judgments. Family members, in turn, feel very frustrated as they have the best interest of their loved one at heart, and the loved one is not seeing it that same way. Please keep in mind that resistance is a normal human trait. People are creatures of habit and comfort, and we become very uncomfortable with changes in our routine and home environment. For older adults, change can be that much harder. They continually experience loss. So loss of relationships, loss of physical ability, loss of independence. And resistance is one way to cope with change because it helps us to maintain our sense of independence. Your best response may be to take a step back and acknowledge their feelings. If you know that your loved one is resistant to the idea, don't expect one conversation to help them see things your way. And if the answer is a resounding no, can you live with that decision? As long as your loved one has capacity and they are able to understand the consequences of their decision, then they have the right to make decisions regarding their well-being, even if you may not agree with that decision. So there may be a plan B that your loved one may agree to. If you push too hard, it's human nature to resist. So take a step back and reevaluate your approach, revisit it at another time. If you are truly concerned about safety and well-being, then I would suggest bringing in a professional who is experienced in dealing with family conflict. APS, or Adult Protective Services, may be another option to consider if your loved one is putting themselves at risk. APS is not a police report, it is a service whose goals include protecting and preventing older and incapacitated adults from abuse, neglect, or exploitation, helping older and incapacitated adults continue to live in their own homes as long as that remains the safest plan of care, and helping older and incapacitated adults become as self-sufficient as possible. The philosophy of APS is to provide the least restrictive intervention necessary to protect the adult and stabilize the situation, and when appropriate, to offer and provide supportive services to adults and their families. So assuming that everything goes smoothly and you are ready to bring care into the home, spend some time preparing the person who will be doing the work. Discuss verbally and provide in writing an idea of the daily routine. Let the caregiver know important information about your loved one. For example, likes and dislikes, illnesses, injuries, signs of a potential emergency situation, possible problem behaviors and how to deal with them. Are there any special diets or nutritional needs? How can you be contacted? And then basics about the house. How to use the household appliances. How is stuff organized in the kitchen, the bedroom? Where do you keep the cleaning supplies? List the name of current doctors, pharmacies, the preferred hospital, cell and work numbers for close family members and friends, and keep all this information in a clearly designated notebook. Last point. Remember that the aides coming into the home are professionals and treat them as such. If something could have been done better, watch how you deliver that constructive criticism. You want the caregiver to remember what you said, not how you said it. people have a tendency to point out the negative. So tell the caregiver if something was done well and let her know that you appreciate the service that is being provided. Regular communication is necessary for solid relationships. So schedule regular times to meet and discuss how things are going, if any changes need to be made. Again, manage those expectations. It is so important to make expectations clear and to provide adequate training to help meet those expectations. Hiring in-home care is not an option for every family. Cost may be too prohibitive, the safety or well-being of the care recipient may be too much at risk, or it may be a flat-out refusal of not allowing a stranger into the home, even though help is needed. However, for families I have worked with who have been able to utilize home care services, they have been very pleased with the results. That's not to say that there haven't been occasional road bumps with setting up the services, because there certainly have been. But the end result of helping to keep their loved one within the community was worth the continued effort of trying to make the care arrangement work. I hope today's presentation provided you with better understanding of hiring in-home care services. And as you have a chance to think more about the information and questions arise regarding the options or the process, please do not hesitate to reach out for assistance. And that can be either to Elderlink directly, Fairfax County's Aging, Disability, and Caregiver Resource Line, or to me personally. Great. All right. Well, thank you very much, everyone, for tuning in. Lucy, do we have any questions to?
Yes, thank you very much. I want to say that was a lot of information in a little bit of time, so everybody take a deep breath. And if you have any questions, you can type them in. I do see a participant with a hand raised, and if you could possibly find either the question button or the chat button on your computer and type in your question, that would be helpful. Otherwise, I will need to unmute you and you'll have to ask your question. So actually there's, I'm trying to expand the question page here. Okay, so question 1, are there legal considerations in caring for an elder?
So I'm wondering, for a little bit of clarification with that question, is that legal considerations from the viewpoint of hiring a provider to come into the home or a family caregiver?
Okay, if you ask that question, please clarify, and we'll move on. Okay. Can the slides used in the webinar be printed? I sent them by email, so that's completely up to your system, but there's no copyright restriction on that on our side. Is that correct, Kristen?
Yeah, these are free for the taking.
Okay.
So if anyone has trouble printing them, I mean, you can let me know and I'd be happy to print out a copy and mail it to you as well. So you can certainly get me by email.
All right. Does Elderlink cost money or is it a free service?
So Elderlink is a fee-for-service. Our case management is based on a month-to-month basis. The fee for the first month is $175, and that includes a case manager coming out to the home to complete a full assessment, developing the care plan, and then working with the individual or any family members involved to coordinate care. And then each additional month would be at $100. We do have a caregiver consult opportunity available, and that's free of charge. So that's a free hour consultation that is done over the phone, or you can schedule a time to come into the office. And that's we're not completing a full assessment, but it would permit opportunities to brainstorm about a situation that is going on at home, to see if there might be any community resources that may be available to help address the issues, or the decision to move forward with private pay case management, if that would be more helpful.
Okay, thank you. All right, so the person who is asking about legal considerations, please let us know if you're talking about for family caregiver or for an outside family caregiver. What does APS stand for is another question.
So APS stands for Adult Protective Services, and this is a service that is in place to intervene in helping to protect older adults from potential abuse, neglect, or exploitation. And it can be self-neglect. So the reason why I mentioned APS was, in the situation where your loved one is refusing care and you are getting very concerned about their well-being, APS can take a look at the situation to see if it truly is a safe situation, or if your loved one no longer has the capacity to be making the decision that is putting them at risk. So it comes down to capacity. If your loved one understands the consequences of their decision and they're still refusing care, there's not much that APS can do. But if a person no longer has that ability to understand, then there's some other avenues that APS may be able to explore.
Thank you. Is Elderlink available in other states, such as Pennsylvania?
Unfortunately, no. We are a public-private partnership with Inova Health System and the Fairfax Area Agency on Aging, but I would suggest contacting the local Area Agency on Aging, and more than likely the social services will have some sort of case management that would be available through the AAA.
So would the elder care locator that you gave a link to be the place to go to find the local area agency on aging, or do you go someplace else?
Yeah, eldercarelocator.gov is a very easy way to find resources in other areas. You can always just Google local area agency on aging and then whatever county that your loved one is residing in, and it should pull up the information for you as well. But Elder Care Locator is a wonderful resource to help find information instead of trying to search all over the web.
Okay. I do see two people still with their hands up. If you could possibly type your question in either the question or the chat panel. I'm looking at both of them, and otherwise I'll need to unmute you, and you'll need a microphone capability to ask your question. So go ahead and try and type it for us. One person is mentioning that the slides that you used are slightly different from the presentation that I emailed, and yes.
I'm sorry, yes. Okay. I made some last-minute adjustments, so I apologize. And I think we added in maybe 2 or 3 slides, so I apologize for not giving everyone the final copy. But I'm
is
sure
there anything critical, like a change in phone number or anything that people need to know?
Let me think. For hiring a private provider, I had the IRS publication, that information included on one of the slides that was not on the first set that went around.
Okay, so if you would like to get an updated, that doesn't sound like a major change, but if you feel like you absolutely need the updated one, email the address that you got your webinar invitation from, and we'll send you the updated slides. Also, this webinar is being recorded, and if you do get a message that the webinar recording is available. That means our recording was a success, and as part of that recording, you will see the actual slides that Kristen used. So thank you for doing that, and thank you to the person who pointed that out so we could clarify. Okay, how do we find specialized language skills?
So that can be somewhat of a challenge. So Fairfax County, the home care registry, if you're interested in an individual provider, they actually list all of the languages that the aides are fluent in, or the individual providers are fluent in. With home health care agencies, it's just a matter of calling to ask if any of the aides are fluent in whatever language you're specifically looking for. It can be a challenge, the communication piece for sure. With some of the families that I've worked with, even though the language may not have matched up between the aide and the care recipient, it still was a successful match in terms of the personal care services that were being provided. It certainly is a lack in regards to the emotional and social contact that can be made, but unfortunately it's just a matter of checking with the individual agencies to see if they might have an aide available in that specific language.
Okay. The phone number that you mentioned, 324-7622, what office is this the number for? I think that was Adult Protective Services, was it?
No, that was actually for the long-term care Medicaid.
Oh,
So
long-term, right. Okay.
yeah, I didn't want to include that just in case that number changed. I didn't want it to be on the slide, but that's the intake number for folks who are interested in applying for long-term care Medicaid. And if you had any more specific questions about the financial eligibility requirements, that is a number that you can call to get your questions answered.
Okay, so I want to take a second here also to mention our 1-hour free caregiver consultation, and that is done through Elderlink, correct, Kristen?
Correct.
Would you like
Yeah.
to mention that and tell people how, what that would entail? Because a lot of your personal and individual questions, it's an absolute great opportunity for you to meet for free with an elder care manager.
Yeah, so it's a 1-hour consultation. You can either schedule a time to come into the office to meet with us, or we can certainly talk over the phone. And it's just an informal way to brainstorm a little bit. If you have a caregiving situation that you're not quite sure how to deal with, we can talk about some possible options to consider. So it offers a little bit of hand-holding and trying to figure out what the next best step may be. And so for some families, it's just getting initial information, and then they feel that they're able to run with it to pursue whatever the options may be. And then in some instances, it turns out that maybe case management would be the next best step for that high-touch type of assistance. So it's more hand-holding, more connecting with resources. The case management is certainly helpful for families who may, just feel completely overwhelmed with the caregiving situation, or for families who don't live in the area, so their loved one is here, they're living 300 miles away, and they don't have the opportunity to stop in and check as often as they would like. So a care manager would provide that more hands-on, eyes-on contact that the family may not be able to provide.
Okay. These two questions are related. What was the IRS publication you mentioned? And if you hire an independent caregiver, then you must also file, I guess they meant, taxes for them with the IRS, correct?
Correct, yeah. So the IRS publication, it was, let me refer back here. I think it was IRS publication 26, the Household Employers Tax Guide. So it kind of walks you through what the withholdings need to be with the number of hours that the provider may be working, the amount of money before taxes need to be filed, what the withholdings need to be.
Okay. All right. Is there some sort of ranking system available for home health care agencies?
I wish there was. No, it really is so individualized. Family A may love a certain home health care agency, and family B had the complete opposite of experience, and never again would they work with that agency. So it really, it's so individualized. A lot comes down to the aide who's coming into the home. That's kind of the initial impression a person gets about the agency. But it's how well the office staff responds to your concerns. I mean, that's what is really setting your tone. So if you feel that you're getting the brush off from the agency, then that's probably not going to be a good fit. There are, a handful of agencies that other family members or other families have worked with, and they've been overall pleased with the care that's been provided, but there's no ranking system, in terms of 5 out of 5 stars that's available. The Medicare website, they do provide a star rating system, but again, that's related to skilled care services, so the physical, occupational, nursing therapy, and it's not connected with a home health care aide, so someone coming in to provide that homemaker or personal care type service.
Right, and somebody else was asking, well, why aren't they screened? I mean, there are so many agencies, and there is no body that does screen them.
Yeah, I mean, all the home health care agencies in Virginia are licensed, and that's through the Virginia Department of Health. But in terms of an actual ranking system for you could always check Angie's List. I mean, that's a suggestion. Those are family caregivers who have been who are experiencing the care through a particular agency. So that might be as close as you get to a ranking system, but it's not. What word am I looking for?
Well, it's not an exact science because,
Exactly.
as you mentioned, I'm chiming in here because I've dealt with several agencies over the past few years, and so some of the things that, on a personal level, and some of the things that come up are how, as Kristen mentioned, how responsive are they when you call? And particularly if you're getting weekend care, make sure you find out who answers the phone on weekends and when can I expect to hear back from them. The aides are very important. I've had, aides from the same company. One is fantastic. One is I hate to say the word, babysitter. So based on those. Now, it's also possible that an agency will give you a couple of references and you can speak to somebody who has used their services. The other thing is it's quite easy to, well, it's not easy, I won't say easy, but when you hire an agency, you should not be signing a contract saying we're going to use you for a year. So if you do run into issues, then you can, you can find other agencies, but it's not very crystal clear. And also, as far as an agency, I think the consistent response that I get from agencies when I say, well, what will you do if my aide is unable to come? The consistent response that I get is, we try our best. So there are, there isn't like an entire pool of home health aides just waiting to be called in case somebody comes, calls in sick or has to go out of town. So,
yes, in those situations, it might be a good idea to be familiar with 2 or 3 different agencies, just so if the first agency is not able to provide that substitute, it's calling the second one or the third one to see if they might be able to fill in a substitute.
and somebody also put in a comment here, couldn't you ask for references, which we just said, or check yelp.com. So I think, today, especially too, going online, you can, you can Google and see what information you find and ask them, ask an agency about their size, how long they've been in business, get a feel for how they interact with you. But no, it's not going to be exact, and you as Kristen pointed out, you may talk to somebody who's used an agency and they're thrilled, and then the aid you get is not really, you may not feel like you're getting what you want, or vice versa. So um, so that's about agencies. And the same thing when you hire an individual. If you're hiring an individual, you will want to ask them for references.
Absolutely.
Yeah. So, but you do get that personal interaction. And the other thing too with an agency is if they say, well, we're having so-and-so going to come and, provide care for your loved one, you can ask to meet that person before they start. So, all right, we are coming up to almost 1 o'clock, and we did get the legal considerations question. Legal considerations for the family caregiver, Kristen.
Okay, so in terms of, and I'm so sorry to clarify again, but there is no, unless you're power of attorney or guardian for the individual, for your family member, there's no legal standard that is forcing you to be a care provider for your loved one if they're needing help. I'm not sure if that's kind of the direction that this question is going.
Or perhaps if I want to take care of my loved one, are there things legally that I need to do, like declare myself the caregiver or have a contract with my siblings? Or
The only, if there was any type of payment being made, it certainly keep receipts, keep documentation of any, if it was a situation where you are a family member, but the family decided, okay, we're going to pay you instead of paying an outside provider, just to keep records of any financial transactions. And the only reason I'm mentioning that is if there was ever the event where it was long-term care Medicaid seemed to be the next step because more assistance was needed at home. You want to make sure that the financial situation of the person applying for care is very cut. Medicaid has a 5-year look-back period, so if they see money going to a family member or they see money being deposited into someone else's account, that may be a penalty for long-term care Medicaid unless there was documentation regarding the reason why there was money going in to the account.
That's a good point. Yeah. And your siblings or other family members, they may not care how many hours you spend on your caregiving, but they will care how much money you use to do it. So there is one person with your hand raised. I'm going to unmute you and give you an opportunity to ask your question, and this will need to be our final question. Everybody does have Kristen's email. As you sign out of the webinar, you'll get a short evaluation survey. Please do that for us. It really helps us. So if you've had your hand raised and you've been waiting patiently, you're now unmuted. So go ahead and ask your question if possible. Okay. So I don't think this person may not. Oops. Are you there? Okay. All right.
No,
Well,
please either, for the person who had the question, either call me directly or send me an email. I really do want to make sure your question is answered, so please feel free to reach out directly.
oh, thank you so much, Kristen. And thank you for today's webinar. Thank you, everybody, for participating. We'll hope to see you at future seminars and webinars. We have another webinar coming up on November 9th. When is it more than just a bad day? And also our final webinar for the season will be on November 16th, Simple Meals for Healthy Eating. Thank you, everybody.